Murimu wa COVID-19 uramenyekanire mwaka wa 2019 mweri-ini wa Dithemba bururi-ini wa China na uria uthiete na mbere na kwagagia thi ngima ni kiambiriria kia thabari ndaya kia murimu uyu amu tugukorwo naguo kwa ihinda iraya.
This virus may be with us for a long time to come, and therefore it requires us, one, to maintain our current containment measures, and to ensure that, two, we can actually chart a way forward as to how we are able to actually live with corona.
We'll have to adapt our lives with the virus in consideration.
Mutabariri wa mihang'o ministry-ini ya Ugima wa Mwiri Mercy Mwangangi augite mihaka ya guku bururi-ini ni kuo kuri na ugwati munene wa kuingiria murimu wa COVID o riri namba ya arwaru yongererekete na arwaru 21.
And from the samples tested today, 21 people have tested positive for COVID-19 disease, and all these 21 are Kenyans. The youngest is 7 years old, whereas the oldest is 79 years old.
Director General wa Ugima wa Mwiri Dagitari Patrick Kamoth augite akenya magirumirira mitaratara iria gathikitwo ni thirikari ya gwithema COVID-19 atingikorwo na bata wa kugathika makinya marumu ona mabiashara maingi maya gucokereria.
So our appeal is to Kenyan people to continue the hand washing, continue the use of sanitizers, the use of your masks. If we can be able to flatten our curve, then there will be no reason whatsoever to continue with the restriction movements. For the healthcare workers, of course, you know we are working on a comprehensive package for all the healthcare workers without discrimination of any particular cadre.
Gukinyaniria na riu bururi wa Kenya uhotete gukorwo uthimite andu 36,918 kuri andu makiria merigerirwo guthimwo guothe bururi-ini. Giribotira Kameme TV, Retorokoni wa Jiro wa Foro.